All right. Welcome, everyone. I'm Dr. Riley Edling, one of the doctors here at the Functional Neurology Center in Minnetonka. Today, I'm going to walk you through a deep dive into one of the most overlooked but most important aspects of concussion recovery, the autonomic nervous system dysfunction. Okay. We'll talk about how concussions affect the ANS, what symptoms this creates, and how we evaluate it, and the steps we take to rehab it effectively. So, why the autonomic nervous system, or ANS, matters. Um, so, it's essentially your body's master regulator. Okay. It runs automatically, managing things like heart rate, blood pressure, digestion, temperature regulation, and breathing. So, just a few things. A healthy autonomic nervous system shifts between sympathetic, or your fight or flight, and your parasympathetic, rest and digest. These systems go seamlessly throughout the day. This added adaptability is key for handling everything from standing quickly to running a sprint or just managing stress. After a concussion, the autonomic nervous system often becomes unstable. Okay, patients uh, classically can feel dizzy when they stand up. They have rapid heart rate spikes or experience overwhelming fatigue, even just with simple activity. Other signs include cognitive fog, intolerance to heat or just crowds, uh, gastrointestinal issues, and sleep disturbances is another really common one. Right? These are not random symptoms. They reflect real dysfunction in the brain's regulatory systems. Key structures involved in autonomic nervous system control. It includes the brainstem. All right. Uh, Key areas like the NTS and vagal nuclei, the cerebellum, particularly the nodulus and uvula of the cerebellum, the insular cortex, and cingulate gyrus for higher level modulation, and the hypothalamus, which creates circadian rhythms and neuroendocrine function. Injury, inflammation, or altered input to any of these areas can cause the system to go off balance. So why autonomic dysfunction happens? There are several mechanisms at play. First, the metabolic and inflammatory response to concussion can damage mitochondrial function and impair regulation. Vestibular dysfunction, common after head injuries. It can lead to poor integration with your autonomic control. Neck issues interfere with proprioception, barrel reflexes, which normalize or they stabilize blood pressure. They become impaired. Anxiety or hypervigilance can amplify sympathetic activity, creating a feedback loop that makes everything worse. Okay. So if we listen closely to symptoms, they can often tell us exactly what's going wrong. All right. Dizziness when standing suggests orthostatic intolerance, fatigue, or flare ups after mild activity point to poor autonomic adaptability. Brain fog, especially when upright or overheated, signals disrupted regulation. All right. Simple as that. All of these are key indicators of autonomic dysfunction, and they should not be ignored. So at the FNC, we use a multi-system approach to evaluating autonomic nervous system dysfunction, just like how we use multi-system approaches for a lot of different pathologies. Um, Starting off, tilt table testing, that's a huge one. That's our gold standard for diagnosing POTS, or orthostatic intolerance. We also measure orthostatic vitals manually as well. Uh, Pupillometry gives us real-time data on parasympathetic versus sympathetic tone. We combine vestibular and balance testing with autonomic monitoring and assess how patients handle cognitive tasks while moving, a true test of brain resilience. All right. Our comprehensive exam includes neurological and musculoskeletal elements. Can't just do one or the other. We evaluate spinal motion and proprioception, especially in the cervical spine, because poor input from the neck can dysregulate the entire system. Right. We test cranial nerves, reflexes, vestibular responses to pinpoint where integration is breaking down. This helps us target treatment more precisely. Rehabilitation begins with graded autonomic exposure. We use tilt table training to slowly build tolerance to upright posture. We progress from laying down to sitting, then sitting to standing, and eventually to a more dynamic movements. The key is titrating exposure below the flare threshold, so the nervous system learns to regulate without overreacting. Next, we introduce the subsymptom aerobic exercise. This might be a light stationary bike or slow treadmill walk, calibrated to the patient's symptom threshold. Research from Letty and colleagues shows this accelerates recovery by improving cerebral blood flow, heart rate control, and parasympathetic tone. And really, it's one of our most powerful tools to getting people back to normal function. All right, activating parasympathetic recovery. So, to rebalance the nervous system, we train patients in vagal activation and breathing techniques because that can be extremely powerful. Slow diaphragmatic breathing combined with HRV biofeedback helps reset parasympathetic tone. We may use vagal nerve stimulation through the neck or the ear, really depends on the case. All right, rebuilding vestibular autonomic coupling. Vestibular autonomic systems are deeply linked. When one is off, the other suffers. Simple as that. We combine VOR rehab, optokinetics, and gaze stability exercises with upright posture and movement. This retrains the brain to integrate visual, vestibular, and autonomic inputs together, which is critical for long-term stability. All right. If one system's off and they all communicate to each other, they're all going to be thrown off a little bit. So the cervical spine plays a huge role in autonomic regulation. After concussion, whiplash or strain can impair proprioceptive feedback and vestibular integration. We use very gentle adjustments, laser guided proprioceptive drills, and reflex training to restore proper communication between the neck and the brain. So we have a case study here, a 24-year-old athlete with POTS. Walk you through it a little bit. Collegiate basketball player came to us 6 weeks after fall. He had daily dizziness, rapid heart rate spikes upon standing, and absolutely crushing fatigue. He couldn't train or even walk across campus without feeling very symptomatic. Tilt table testing confirmed POTS with a 40 beats per minute increase in just 10 minutes. He also had a reduced VOR, vestibular ocular reflex function, and also had cervical proprioceptive errors. We implemented a custom program, daily tilt table training, subsymptom aerobic exercise, cervical laser drills, paced breathing, and VOR rehab on top of it. By day 5, he could tolerate standing without being dizzy. All right. By week 3, he was back on the court, doing low intensity drills with full resolution of symptoms and normalized heart rate response. So it's a pretty cool case. The hidden barrier. So this is why autonomic dysfunction matters. When it's missed or ignored, it becomes the silent barrier to recovery. Patients can't tolerate rehab. They stay fatigued and symptoms drag on. But when we identify and treat it early, we can accelerate recovery, not just from the symptoms, but also with endurance, clarity, energy, and emotional resilience. At the FNC, we don't just treat vision, balance, neck, or autonomics in isolation. We integrate them. Everything's a coordinated system, so you can't just pick one or two things. We got to address everything. And that's how we help patients rebuild their nervous system from the inside out. Want to thank everyone for attending, listening to this video. Thank you for joining me. And I hope this gives you a little bit of a deeper insight and understanding of how and why we approach concussion recovery the way we do, and all the different layers of complexities on top of it. So thank you, everyone. And for everyone tuning in, I hope you have a fantastic day.